Hey everyone, this is Abby from nursing.com. Today, our lab value. Hey everyone, this is Abby from nursing.com. This lesson is going to cover a lab value for mean platelet volume, abbreviated as MPV. Let's get started. Mean platelet volume is a measurement of the average size of a patient's platelets, average and mean. It's measured by volume and recorded in femtoliters. Femtoliters are 1/4,000th of a liter. Things that affect platelet size are the age of the platelet. Older platelets tend to be a little smaller, their rate of production, and their function in inflammatory states. This lab value is an aid in diagnosis. It's never used in isolation. It helps diagnose certain thrombocytopenias and also diseases of the bone marrow. Some factors that affect mean platelet volume or the average size of platelets are when you're living at high altitudes, meaning you have a lower oxygen content in the air, and in inflammatory states like vigorous exercise routines. Some clinical indications or some reasons why we would test mean platelet volume are if our CBC returns abnormal. We want to monitor aplastic anemia with our MPV to know if our treatment is effective or not. Congenital thrombocytopenias, as mentioned, are a way or a reason rather to monitor, and then myelodysplastic syndromes are also a reason to monitor our MPV. Now, what would we see in clinical presentation with a patient? They could have bleeding. This could be from anywhere, but we also will see it first in a skin evaluation. So this could be little petechiae that have formed, or it could be nice, big, dark purpura. These patients may present with headaches, dizziness, chest pain, and numbness and tingling. Platelets, of course, are a big part of the CBC. The MPV is part of the differential. Normal therapeutic values are between 9 and 10 femtoliters. They're collected in a lavender tube as part of the CBC. Lab values that are increased for the MPV indicate macrocytic or large platelets. Just look at the size of this platelet in comparison to the red blood cell. It should never be that, right? It could also mean that there's an overproduction of platelets, a high destruction of older platelets, or that it's a presentation from congenital thrombocytopenia. Also, serial lab studies will be taken in patients that have a case where they're recovering from bone marrow transplant or some type of other disease or disorder. Lab values will be decreased, or the average size of platelets will be smaller or microcytic when platelets are older, or it could even be indicative of bone marrow suppression. This could be if someone's receiving cytotoxic medication therapy like that of chemotherapy, and in patients with aplastic anemia. Now, we see this congenital thrombocytopenia again. Remember, not every thrombocytopenia is going to look the same, and not every lab, and particularly not the MPV, will be taken in isolation for diagnosis. We also see decreased values or really small platelets in irritable bowel diseases like Crohn's and ulcerative colitis. This picture is showing a much better view of what size the platelet should be in comparison to red blood cells. This in particular is a little clot that has formed. The linchpins in this lesson are to remember that the mean platelet volume measures the average size of platelets. A normal size is between 9 and 10 femtoliters, and an increase in size would make it a macrocytic platelet. If the value is decreased, we have tiny platelets and they might not be as effective. Now, you all did so great on this lesson. Remember, we love you guys. Now go out and be your best self today, and as always, happy nursing.